Josef Mengele was a World War II physician and officer of the German Schutzstaffel, a paramilitary organization under the Nazi Party, and commonly known as SS. He received the moniker, Angel of Death, for performing deadly experiments on prisoners in the Auschwitz concentration camp as a member of a team of doctors who selected victims to be killed in the gas chambers. He also administered the gas. Before the war, Mengele received doctorates in anthropology and medicine and began a career as a researcher. In 1935, he completed his dissertation, titled Racial Morphological Examinations of the Anterior Portion of the Lower Jaw in Four Racial Groups. The work sought to demonstrate structural differences in the lower jaws of individuals from different ethnic groups, and that racial distinctions could be made based on these differences, and that these evidences proved one race was superior to another. This publication earned him a PhD in anthropology from Munich University. He joined the Nazi Party in 1937 and was assigned as a battalion medical officer at the start of World War II. By July 1942, SS doctors were conducting selections where incoming Jews were segregated, and those considered able to work were admitted into the camp, while those deemed unfit for labor were immediately killed in the gas chambers. The arrivals that were selected to die, which were about 3/4 of the total, included almost all children, women, pregnant women, the elderly, and those who appeared unfit or unhealthy. He was next assigned to the SS Race and Settlement Main Office, evaluating candidates for Germanization. He was transferred to the Nazi concentration camps in 1943, where he saw the opportunity to conduct genetic research on human subjects. Nazi physicians and their assistants forced prisoners into participating. They did not willingly volunteer, and no consent was given for the procedures. Typically, the experiments were conducted without anesthesia, and resulted in death, trauma, disfigurement, or permanent disability, and as such, are considered examples of medical torture. One documented experiment was on the study of head injuries, and involved an 11 or 12-year-old boy, who was strapped to a chair so 90% of his body could not move. Above him was a mechanized hammer that every few seconds came down upon his head, with a force light enough not to cause a concussion, but strong enough to leave red welts on the skin. The boy was eventually driven insane from the torture, the damage irreversible. Experiments were also conducted at the Ravensbrück concentration camp, for the benefit of the German armed forces, to study bone, muscle, and nerve regeneration, and bone transplantation from one person to another. In these experiments, subjects had their bones, muscles, and nerves removed without anesthesia. As a result of these operations, many victims suffered intense agony, mutilation, and permanent disability. A survivor, named Jadwiga Kaminska, gave a deposition and described how she was operated on twice. Both operations involved one of her legs, and although she never describes having any knowledge as to what exactly the procedure was, she explains that both times she was in extreme pain and developed a fever post-surgery, but was given little to no aftercare. Kaminska describes being told that she had been operated on simply because she was a young girl and a Polish patriot. She describes how her leg oozed pus for months after the operations. Some prisoners were experimented by having their bone marrow injected with bacteria to study the effectiveness of new drugs being developed for use in the battlefields. Those who survived remained permanently disfigured. Mengele's experiments focused primarily on twins, with no regard for the health or safety of the victims. He managed to procure nearly 1,500 sets of imprisoned twins at Auschwitz. The twins were arranged by age and sex and kept in barracks between experiments, which ranged from amputations, infecting them with various diseases, and injecting dyes into their eyes to change their color. One pair of children were sewn together by their backs, in an attempt to create conjoined twins. This resulted in gangrene around the operated area, and eventually led to death. In other experiments, one twin would be forced to undergo a procedure, while the other was kept as a control. If one twin died from experimentation, the second twin would be brought in to be killed at the same time. Doctors would then look at the effects of experimentation and compare both bodies. If the first twin survived, Mengele would dissect their bodies. About 200 people survived these studies. The other SS doctors did not administer treatment to the Auschwitz inmates, but supervised the activities of imprisoned doctors, who had been forced to work in the camp medical service. Mengele made several weekly visits to the hospital barracks, more than what was required of his stipulated duties, and ordered any prisoners who had not recovered after 2 weeks in bed to be sent to the gas chambers. Mengele's work also involved carrying out selections, a task that he chose to perform even when he was not assigned to do so, in the hope of finding subjects for his experiments, with a particular interest in locating sets of twins. In contrast to most of the other SS doctors, who viewed selections as one of their most stressful and unpleasant duties, he undertook the task with a flamboyant air, often smiling or whistling. He was one of the SS doctors responsible for supervising the administration of Zyklon B, the cyanide-based pesticide that was used for the mass killings in the Birkenau gas chambers. When an outbreak of Noma struck the Romani camp in 1943, which was a gangrenous bacterial disease of the mouth and face, Mengele initiated a study to determine the cause and develop a treatment. He enlisted the assistance of prisoner Berthold Epstein, a Jewish pediatrician and professor at Prague University. The patients were isolated in separate barracks, and several afflicted children were killed so that their preserved heads and organs could be sent to the SS Medical Academy in Graz, Austria, and other facilities for study. This research was still ongoing when the Romani camp was liquidated, and its remaining occupants killed in 1944. Mengele used Auschwitz as an opportunity to continue his anthropological studies and research into heredity using inmates for human experimentation. His medical procedures showed no consideration for the victim's health, safety, or physical and emotional suffering. He was particularly interested in identical twins, people with heterochromia iridum, or eyes of two different colors, dwarfism, and people with physical abnormalities. A grant was provided by the German Research Foundation, at the request of von Verschuer, a German human biologist and geneticist, who received regular reports and shipments of specimens from Mengele. The grant was used to build a pathology laboratory, attached to Crematorium II at Auschwitz. Miklaus Nischli, a Hungarian Jewish pathologist who arrived in Auschwitz on May 1944, performed dissections and prepared specimens for shipment in this laboratory. The twin research was in part intended to prove the supremacy of heredity over the environment, in determining phenotypes, and thus strengthen the Nazi premise of the genetic superiority of the Aryan race. Nischli and others reported that the twin studies may also have been motivated by an intention to uncover strategies for racially desirable Germans to reproduce more twins. Mengele's research subjects were better fed and housed than the other prisoners, and temporarily spared from execution in the gas chambers. His research subjects lived in their own barracks, where they were provided with a marginally better quality of food, and somewhat improved living conditions than the other areas of the camp. When visiting his young subjects, he introduced himself as Uncle Mengele and offered them candies, while at the same time being personally responsible for the deaths of an unknown number of victims, whom he killed via lethal injection, shootings, beatings, and his deadly experiments. In a 1986 book by Robert J. Lifton, an American psychiatrist and researcher, he describes Mengele as sadistic, who believed that Jews should be eliminated as an inferior and dangerous race. Mengele's son, Rolf, later claimed that his father had shown no remorse for his wartime activities. A former Auschwitz inmate doctor noted that Mengele was quite manipulative, capable of being so kind to the children, to have them become fond of him, to think of small details in their daily lives before sending them to the crematoria in a matter of hours or even minutes, murdering without batting an eye. After the war, Mengele fled to Argentina in July 1949, assisted by a network of former SS members and Nazi sympathizers. He initially lived in and around Buenos Aires, where he worked as a doctor under an alias. But he was questioned in 1958 on suspicion of practicing medicine without a license, when a teenage girl died after an abortion, but he was released without charge. He fled to Paraguay in 1959, and then Brazil in 1960, all the while being sought by West Germany, Israel, and Nazi hunters, who wanted to bring him to trial. Mengele eluded capture in spite of extradition requests by the West German government and clandestine operations by the Israeli intelligence agency. At age 61, Mengele's health steadily deteriorated. In 1979, while swimming, he drowned after suffering a stroke and died in the cold waters.